Michigan is one step closer to having a mental health hotline. The state Senate passed legislation today creating the Michigan Crisis and Access Line. It would connect people in Michigan with mental health resources throughout the state. The Michigan Protection and Advocacy Service tells our Christiana Ford they're excited to see action from the state that would help the people they serve.
I know what it feels like to feel helpless. I know what it feels like to not know where to go for somebody that you care about.
State Representative Mary Whiteford is talking about her experience trying to get help for a loved one in a mental health crisis.
I called my local community mental health and they told me, well, if the person's not on Medicaid or suicidal, we can't help you. And then I called some local providers. They weren't taking new patients and it was an 8-month wait.
For 3 years, Whiteford worked to get a statewide mental health hotline. This week, the Senate voted to create the Michigan Crisis and Access Line, connecting callers with needed resources.
An individual can call. You can be a teacher. You could be an emergency room nurse trying to find a bed for your somebody who's in crisis, a psychiatric bed. It could be a police officer, a teacher, just somebody who knows that somebody that they care about needs help.
Mark McWilliams with the Michigan Protection and Advocacy Service says the hotline would address a long-standing problem.
There are stories, if you talk to providers, about having to call around and making dozens of phone calls before they can find a service that a person needs. Often it's kind of short-term crisis intervention or crisis support stabilization.
The nonprofit serves those with disabilities and mental illness. McWilliams is happy to finally see some action.
There are problems getting community services especially, and so to see that there's legislation moving forward, even making a change like this is really gratifying. It's not going to solve all of our problems, but it is something that we can do given our current resources to try to make service easier.
And that was Christiana Ford reporting. The State House has to approve some changes the Senate made before the bill goes to Governor Gretchen Whitmer's desk. When passed, Michigan's hotline would combine the suicide hotline, opioid hotline, and inpatient psych bed registry. Our state would become only the second state in the nation to have a service like this one.